In most of the country, economic recovery from the pandemic is gaining momentum, but many people still need time to pick up where they left off or make new adjustments. That's the main reason for additional relief money from Washington, some of it being used to make health coverage more affordable. To tell us how that changes options from the Massachusetts Health Connector is the Chief of Policy and Strategy, Audrey Morse Gasteier. Thank you very much for being with us, Audrey.
My pleasure. Thanks so much for having me on.
Audrey, what about this? It sounds like a windfall from Washington. So how big a change is this as far as the cost of health coverage?
The American Rescue Plan has been a game changer for health coverage affordability here in Massachusetts and across the country. This was a law that was passed back in March and has promised to bring in about $600 million into the Commonwealth of Massachusetts to lower people's health insurance premiums. And for people to access those, they need to get health coverage through our state's official health insurance exchange, the Health Connector. And we've seen these savings mean real, practical, meaningful help for people here in Massachusetts, people who already get their health coverage through the Health Connector, who've seen their premiums drop from hundreds of dollars a month into the single digits, and new people coming in to take advantage of these new opportunities to get lower cost health coverage here in Massachusetts through the Health Connector.
Well, there are people who may or may not have qualified for the connector before, but they might have looked at the options and decided that this doesn't look so great. My income might be too high to get much of a subsidy. What should they be thinking now?
It's a great question. So what this law did was allow people who were already qualifying for some help paying for their health coverage over the last several years and give them even more help. So people who were getting some subsidies through the Affordable Care Act are seeing even lower premiums. But very importantly, to your point, there are people who previously earned too much money to qualify for subsidies to lower their health coverage. And that's somebody earning about 400% of the federal poverty level, or in real dollars, that's someone earning about $51,000 a year. And the new law says people earning even over that amount can qualify for help lowering their health coverage premiums. So it's a real game changer for middle income individuals who weren't qualifying for help before, but really were facing very, very steep, stark premiums that made affording coverage fairly challenging. So for people in that boat, whether that's people who may not have coverage, decided to forego it because of the cost, or people who've been buying their own health coverage on their own, buying directly from an insurance company with no help from an employer or through subsidies, this is really the important time for them to take a look at their options through the Health Connector, because there's help available for them that was never there before. And for people who may be in that boat, checking out our website, which is www.mahealthconnector.org. When you come to the webpage, there'll be a little pop-up that says, learn more about the American Rescue Plan, and that will take you to a calculator that takes 2 minutes to include some information about yourself, where you live, how old you are, how much money you make, and that will give you an estimate for any subsidies that may be available for you. So it's easier than ever to qualify for coverage, and it's easier than ever to find out what help may be on the table for you.
It's one thing to have lower premiums, and I know this can vary from one plan to the next, but there are people out there wondering, okay, well, what about the out-of-pocket expenses? Are those going to be any better, at least across the board?
Sure. So what this law does is give people more money to buy coverage. And one of the things they can do with that is what we call kind of buy up. They can buy coverage that has even lower deductibles or copays. So that's important, again, because one of the ways people have been trying to kind of hang on with affording health coverage over the years is to buy coverage that has ever higher deductibles, which are very difficult for people to afford when they do need to go and utilize healthcare services. So getting more of these subsidies means it's easier for people to purchase coverage that won't subject them to particularly high cost sharing, copays, deductibles, and the like. Also important for people to understand, the Health Connector runs a program called Connector Care. And actually, most of the people we cover qualify for this special program, which leverages federal subsidies through the Affordable Care Act and also puts state money on the table as well, particularly on the cost sharing side. So anybody who qualifies for Connector Care, and that's someone earning about $38,000 or so a year or less, qualifies for Connector Care, and that coverage has no deductibles and very low, if any, copays. So there's never been a better time for people to check out what they qualify for, what they may be eligible for in the way of help affording premiums, but also how valuable and affordable that coverage is to actually use as well.
I want to ask you about another new feature, and this is for people who've been eligible for unemployment compensation, at least I think once during 2021. What would this do?
Exactly. Great question. So in addition to some of the benefits I've been describing, where more people than ever before can qualify for subsidies helping pay for their coverage through the American Rescue Plan, the American Rescue Plan also included a very specific, very, very generous benefit for anybody who's been on unemployment income, unemployment benefits during 2021 for even at least 1 week. So even if you qualified for unemployment income back in February and you're no longer receiving it, if you're on unemployment income right now, you would qualify for this benefit. And what it does is it allows you to come to a health insurance exchange like the Massachusetts Health Connector and qualify for a $0 health coverage plan. So that's a tremendous benefit, obviously, to anybody who's dealing with unemployment right now or recently has been, is trying to get back on their feet. And that's a benefit that will be available through the rest of 2021. So anybody in that circumstance should come to the Health Connector, apply for coverage, include on your application that you are receiving unemployment income. And we have information about this on our website and how to utilize that benefit. So people should visit www.mahealthconnector.org to learn more about the $0 coverage option for anybody in Massachusetts who's been on unemployment income for at least 1 week during 2021.
Now, I do have to ask you about another wild card here, is that there are people who do not have the status of being a full-time employee. They might not have had that regular eligibility for unemployment compensation. What about their options?
So I believe for those individuals, they should still come to the Health Connector, absolutely. Check out their options, because if they had reduced income due to unemployment, even if they didn't qualify specifically for that benefit, the Health Connector is absolutely the right coverage source for you. It's kind of a one door, no wrong door entry to Health Connector coverage, or if they qualify for Mass Health coverage, our state's Medicaid program. So even if they didn't qualify officially for unemployment income and wouldn't therefore qualify specifically for that American Rescue Plan benefit for people who've been on unemployment, they still may qualify for a $0 or low dollar plan through the Health Connector. So they should absolutely come check out our website and explore their options as well.
One other category I want to ask you about is people who've been buying their health coverage from the Connector already. They have not really hit a rough patch during the pandemic, but there might be an opportunity to either get better coverage or save some money. Should they be looking at the enrollment options too?
They absolutely can. So what we're in right now is called a special enrollment period or an extended open enrollment period, and that will be running through July 23rd. And that's an opportunity for anybody in the state to come into coverage, find out what they qualify for, find out what they're eligible for, select a plan, get enrolled. It's also an opportunity for people who are already covered through the Health Connector. If there is something they want to change, make a switch, they can certainly do that as well. And our next open enrollment period will begin on November 1st. So if people don't have that opportunity to make that plan change that they might be interested now, that's their next upcoming opportunity. But we really do want people, particularly people who are not currently covered, to take action by July 23rd and get in before the end of this extended open enrollment period we've been running for many months now as a result of both the pandemic as well as the new affordability supports available through the American Rescue Plan that we really want to maximize and get out to as many Massachusetts residents as possible.
For people who have not had this kind of coverage in the past, and you want to tell them why it really is important, not just to wait for an emergency, what are people missing? I mean, what did we miss during the pandemic when we put off all those appointments for elective primary care? What's the danger?
Exactly. So health insurance is an incredibly important tool, both for people's healthcare access, but also their financial protection. It's critical that people don't put off having coverage just because they think they're healthy, they're not going to get sick. We know there's certain populations, younger people who may feel like I don't have those needs, I can go without coverage. But one never knows what might befall them, and having access to preventative care, vaccines, all kinds of healthcare services that can help keep you healthy, keep you from getting sick are critical. And the COVID pandemic, if nothing else, has taught us how important it is for that access to healthcare to remain unfettered, to remain affordable for people. It's just crucial. And we know that people can fall into debt and all kinds of other financial challenges if something unexpected does befall them. We don't want to see any Massachusetts residents in that circumstance. And we're so fortunate to live in a Commonwealth that has placed so much emphasis on healthcare access and affordability. And we have this tremendous help from the federal government with the American Rescue Plan, with the Affordable Care Act, and really marrying these two together and making sure all of our residents, all of our communities have this really important access to protect their healthcare access and their financial safety as well is really, really important.
Finally, a word about vaccines. The mass vaccination sites have closed, but people still need shots, at least many of them do. And what about the ability to get it? How hard is it now?
It's very easy. There's a lot of opportunities for people to get vaccines in their community. The state is running all kinds of programs to really facilitate access all across the state for all different populations. There's trains coming through the state. People can access it through their healthcare providers, even in their home, if they're not able to get out of the home to get vaccines. So people should absolutely explore their options. The Health Connector's been enthused to communicate with our own members about making sure that they're availing themselves of the COVID-19 vaccines to ensure their health and the health of their communities as well.
And one last time, the website for the Connector?
www.mahealthconnector.org, and we encourage everybody to visit well in advance of our July 23rd deadline. Get covered if you don't have coverage. Make sure your friends, your family, your neighbors are covered. And we have help available in local communities, in person, remotely, in all different kinds of languages. For example, the Boston Public Health Commission, the Cambridge Economic Opportunity Committee. There's many other organizations that can provide in-person, in-community assistance, and all that information is available at our website, mahealthconnector.org.